Okay, good afternoon, everyone. Thank you again for being here. Thank you for getting the message out to communities. It's, again, valuable, the work that you do. So we've spent the better part of a year working to protect the health and safety of residents across the Northwest Territories. We've been successful at limiting the spread of COVID-19 in our communities. However, we knew that there was always a possibility that cases of COVID-19 would be confirmed in our smaller communities. So we prepared. The government of the Northwest Territories has been committed from the beginning of the pandemic to preparing for this challenge that might be put before us. Our pandemic efforts to date have proved that. Yesterday, it was confirmed that Fort Liard had its first 3 confirmed cases of COVID-19. My thoughts are with the individuals who are recovering in isolation. This is a difficult situation, and I know that the community of Fort Liard will be strong, supportive, and resilient during this challenging time. You are not alone. The government of the Northwest Territories will be there for you every step of the way. We have an incredible team of healthcare professionals who will be working around the clock to ensure that we can find a way to limit the spread of the virus in the community. I have been in contact with the ADKFN Chief Hope and spoke with Fort Liard Mayor Hilary Deneron, and I'm committed to keeping open lines of communication with community leaders to ensure we support their needs so they can continue to effectively support their community needs. The active cases in our territory are a reminder that we must continue to be diligent in our efforts to protect the safety and well-being of our residents, especially those who are most vulnerable to the virus. As individuals, we must not only be thinking about protecting ourselves, but those around us who you may pass on the street or in the grocery store. This is bigger than our individual self, and we must continue to be diligent in our efforts to limit the spread of the virus. This also means going about our days with respect, empathy, and kindness. This includes treating individuals who test positive, either presumptive or confirmed, as we would want to be treated. Even when taking every possible precaution, people may still contact COVID-19. As neighbors, we should be reaching out with support, not speaking negatively to each other. We all need to do our part and take care of one another. It is the way of the North, and we are Northerners. On that now, I'd like to turn it over to Minister Green to provide opening remarks. Again, thank you, everyone.
So Minister Green, as you all know, she's on the phone. Minister Green, you can go ahead and deliver your remarks.
Okay, good. Just confirming that you can hear me.
Yeah, we're good.
Thank you. Good afternoon, and I want to first of all thank Chief Hope and Mayor Deneron for their leadership and cooperation with our teams as we work to get the full picture throughout this investigation. Staff have been in contact with Acho-Denico First Nation and the hamlet of Fort Liard regularly since we became aware of new cases and the possibility of more. We will continue to work together to keep everyone safe. I want to thank Fort Liard residents for the commitment we've seen both on the ground and online for following public health measures and keeping the community safe. And of course, I want to thank the dedicated healthcare professionals working around the clock to respond to the situations we face today. I want to acknowledge that our territory is navigating more uncertainty than we have had to date during this pandemic. It's understandably making residents feel anxious in the communities of Fort Liard, Hay River, and Yellowknife. That anxiety is natural. What's important to understand is that, as the Premier said, we've been preparing for these kinds of situations. Our pandemic response plan provides direction for the health system to respond quickly and efficiently to situations such as those we're now facing. The Emergency Operations Center has been fully activated to guide decision-making and work across government to access the required support necessary to bring these situations under control. Some actions taken to date include the deployment of rapid response teams to investigate the situations in Fort Liard and Yellowknife and provide support to frontline healthcare workers. Increased resources to support targeted testing in Hay River, and ongoing coordination with the COVID Secretariat and other GNWT departments to support the emergency response and the needs of residents, especially those in Fort Liard. Improvements in our testing capacity have meant that point-of-care testing is immediately available in affected communities, and test results can be validated quickly within the NWT. This is critically important to our overall ability to respond quickly to potential outbreak situations. I want to now give more detailed information in Fort Liard. Yesterday, the Chief Public Health Officer issued a containment order for the community for 14 days. This measure is necessary in order to limit the potential spread of COVID in the community. I want to be clear about what this containment order means and what it doesn't. It means no gatherings, indoors or outdoors, with people you don't live with, in private homes or larger gatherings like hand games or community feasts. It means non-essential businesses and facilities need to close, including community centers. It means offices and essential businesses like the grocery store can stay open, but 6 feet of physical distance must be maintained at all times, and a maximum of 10 people can be at the business at any one time. It means in-person classes at the school are canceled and students will be supported to learn at home. And this is very important. It means masks are now mandatory in all public spaces. Child care services may continue in both day homes or in a facility. This is a big list, and I recognize that the restrictions are difficult for Fort Liard residents, but it's necessary to contain the potential spread of the COVID-19 virus. Dr. Kandola will provide more detail in her remarks. I understand there may be a lot of questions in these anxious times. Many in Fort Liard are used to calling their health center for advice. What you need to know is that right now staff at the health center is working hard on contact tracing and testing and may not be available to respond to questions and provide advice. Instead, please call 811 if you are looking for information on the new rules in Fort Liard, information about COVID-19, or getting the latest updates. They have all the information that you need, and they are there to help. So please call 811. If you feel sick and you want to arrange for testing or access to any other medical care, that's when to call the health center. I want to reiterate what the Premier said, that this is a difficult time, and I want to remind everyone to be kind. The worst thing we can do is to lash out in anger at each other and spread misinformation. What we don't want to do is create stigma and fear. We want to create a supportive environment which will encourage people to be tested and contain the potential spread. The best thing you can do to channel your anxiety is to find productive behaviors like sticking to healthy habits, committing to following public health measures, and keeping up to date with verified sources from our healthcare staff on new developments. In Fort Liard, we're providing the community with messages in English and South Slavey about the requirements of the containment order on the radio. We have placed social media advertising to reach everyone in the community with information on investigations and staying safe. We are working with community health representatives to get information out on the community radio regularly. Print materials are being distributed across the community so people have the information they need. And we will update the public and media regularly with information about ongoing investigations in Fort Liard and around the territory. I would now like to invite Dr. Kandola to provide additional detail on our response. Thank you.
Thank you, Minister Green. We're now going to let Minister Green head over to the public health clinic, and she's going to get tested to ensure that her sniffles are nothing more than a sniffle. And then we'll now invite Dr. Kandola to provide her report.
Thank you, Minister. Yesterday evening, I issued a local containment order for the community of Fort Liard. This order will last until January 30th at 10 p.m. It may be extended if necessary. This was in response to a large amount of contacts resulting from confirmed cases over the last 48 hours. When there are a large number of contacts, there is a much higher likelihood of there being additional cases and a much higher likelihood of onward transmission. The measures in the containment order are designed to mitigate these risks. The principle at hand is limiting opportunities where people come into close contact with one another. We believe that taking these strong early actions in partnership with local leadership, we will be able to bring the situation under control quickly. I want to provide an update on the Fort Liard investigation. We have thus far identified 3 cases in Fort Liard. We believe there is a good chance there will be additional cases identified as work from the rapid response team continues. We are confident that the source case was linked to travel outside the Northwest Territories. We have not identified any public exposure events along the travel route or in any other communities at this time. If this changes, we will update you. There are currently approximately 50 individuals isolated in Fort Liard as contacts of confirmed COVID-19 cases. This number has been dynamic over the last 24 hours, and it may change quickly. Our rapid response team is on the ground supporting local health staff to test, trace, isolate individuals in the community who may have been exposed. Their work will continue over the coming days. From there, we are building out any new networks of contacts and exposures we can identify, and confidentially getting them the advice they need. Right now, we would classify this as a small community cluster. All identified infections from a known source. We will update on any change to this characterization should they occur. I would also now like to update on the continuing investigation into the Hay River wastewater signal. Roughly 150 individuals have responded to the call to come forward and be tested. We really appreciate everyone who has come forward. We have yet to identify additional cases of COVID-19. However, we are exploring the potential of connection between the Fort Liard cases and the Hay River wastewater signal. The individual who was tested for COVID-19 responded to the public health advisory, indicating anyone who had been in Hay River during that period should be tested. They had returned to Fort Liard already and were tested there. We do need more data about wastewater in Hay River to pursue this theory further, and we do expect these results in the coming days. I now want to provide some updates on our continuing investigation in Yellowknife. Our rapid response team has been completing reverse contact tracing to explore any possible sources of infection for this case. Our investigation has led us to explore a potential connection with Avon Seniors Manor. Staff and select residents are being tested for COVID-19 as part of that effort. I want to be very clear. There is no indication of any exposure risk at Avon's right now. We are simply exploring new leads as we cast a very wide net to attempt to identify the source of infection. So there is no need for alarm. We know that nearly 450 tests and counting have been completed in Yellowknife in the last 2 weeks. If there was widespread transmission, we would expect to have seen additional positive COVID-19 diagnosis. We have received additional wastewater results in Yellowknife. The signal remains stable at trace levels and brings us to January 11. Additional information about our wastewater signal will be very useful in our continuing investigations in Yellowknife over the coming days. As these investigations continue, I want to talk a little bit about contact tracing. Contact tracing is when public health professionals interview people and review data about where they were and who they spent time with while they have a communicable disease. It is highly confidential because people deserve their medical privacy, and we need everyone to feel comfortable when they're talking to us. If people don't feel confident in talking with us, then everyone is less safe. This is part of why you won't see deep detail into every individual case. These kinds of details could give enough information to single people out and open them up to stigma, especially in a small place like Northwest Territories. It's also important to understand if you walked past someone in the store or on the sidewalk who wound up being positive for COVID-19, it wouldn't necessarily mean you would be considered a contact. It takes 15 minutes where it's likely you were within 2 meters of someone positive with COVID-19 to be considered a contact. This is in line with the Public Health Agency of Canada guidance. If there's any doubt as to whether public health has been able to reach contacts confidentially, there will be exposure notices issued publicly to get people who may be at risk to come forward. So if you have not been reached by public health and you do not fit into a category identified in a public exposure notification, you do not have any reason to be worried. The situations which have arisen this week underscore the importance of getting your vaccine as soon as it becomes available to you. The vaccine will go a long way to protecting you from getting sick from COVID-19. And the sooner we reach high levels of vaccination, the sooner we will all be better protected. As we get closer to that light at the end of the tunnel, it is crucial more than ever to stick to the healthy habits we know work to stop COVID-19. So stay home, even if you're a little bit sick. Call your local health center and get tested for COVID-19 at the first sign of sickness. Prioritize physical distance of at least 6 feet between yourself and others. Wear your mask when you're in public. Keep crowds small and spaces large. Wash your hands frequently. Cough or sneeze into a flexed elbow or tissue. And please self-isolate when required. By taking these steps, you can keep yourself and others safe. And we have all made a lot of sacrifices this past year. Let's keep it up as we roll out our vaccines and make them all matter. Thank you.
We'll now invite Dr. Pegg to provide some comments.
Thank you. Yesterday, as you know, we became aware of a case of COVID-19 detected in Fort Liard after an individual presented for testing after becoming symptomatic. An ongoing contact trace investigation is underway, with 2 more positive cases found yesterday, for a total of 3 positive cases in the community. In order to help support health services on the ground in Fort Liard, yesterday afternoon, the Northwest Territories Health and Social Services Authority sent out our COVID-19 rapid response team to add capacity to the Fort Liard Health Centre. This adds 2 nurses and 1 logistician, in addition to the staff already on the ground, and this team arrived at 4:30 yesterday afternoon. This team is currently underway in assisting with contact tracing, but most importantly with testing of residents who've been identified as high-risk contacts and those who have also been identified as a lower-risk contact. This testing is happening off-site from the health centre in order to preserve the capacity of the Fort Liard Health Centre to maintain current health programs. At this point, as you've heard, we're asking all residents of Fort Liard to call 811 for information related to COVID-19, related to public health orders, and with any questions regarding isolation. We're also asking that if residents have questions about testing, where to get tested, or how to access testing, that they phone the health centre, where they'll be directed probably to a secondary number, which will help with the organization of off-site testing in order to make sure that any resident who's been identified as a contact or who feels that they may have been a contact can access testing. This is really important. We don't want people showing up at the health centre in great numbers in order to limit gathering size, although we do stress that if there is an emergency, please do not hesitate to contact the health centre. We have rapid testing available in the community and are able to turn around results quickly on site. This is done with a point-of-care testing device, and all results are sent to a hospital lab in order to be confirmed. We also have a regularly scheduled physician who will be visiting the community today, who will be continuing to examine and allocate resources as needed. We know that this is a scary situation for residents of this community, both Fort Liard as well as other communities. What we are asking, as has been said already, that people be supportive of one another, take the time to reach out, and to be kind. I'd also like to reiterate, as Dr. Kandola mentioned, that information shared as part of a public health investigation or shared with healthcare professionals remains confidential. For those residents who are either positive or contacts of a positive case, the health authority is working directly with them to ensure that they can safely isolate. More than 80% of cases of COVID will recover at home with little need for medical intervention. But we have a very strict process to follow any positive cases, to ensure that they have regular check-ins for symptoms, to ensure that their symptoms remain mild, and if there is a deterioration in the clinical condition, we have a process to move that person out of the community. Clinical contact is also ongoing with members of the healthcare team to ensure that they feel comfortable monitoring the symptoms for patients who are positive or who are isolating in Fort Liard. Symptom checks by health centre staff are done to ensure individuals have the support they need also to effectively isolate, to ensure that they have the supports available to do so in their homes or where they choose to isolate, and to ensure that their illness is monitored and the appropriate level of care is provided. On Thursday of this week, there is a planned vaccination clinic for the community of Fort Liard. This will go ahead as planned. All residents age 18 or older who are eligible for the vaccine will be offered vaccination at this time. And residents are encouraged to watch for further information that will be available from the health centre regarding the rollout of this vaccination clinic. As Dr. Kandola mentioned, there's also a rapid response team that has been deployed in Yellowknife in order to assist with testing related to the positive case identified here. The rapid response team has been deployed to Avens to test residents, to test on-site staff and any potential on-site visitors this afternoon. And other staff and visitors are instructed and requested to present for testing at the COVID testing site at 108 Archibald Street here in Yellowknife. I'd really like to thank the community of Fort Liard, the health centre staff, the community of Yellowknife, and the communities of Hay River for all of the ongoing extremely hard work and dedication that's been shown during this time, and we will get through this together. Thank you.
Thank you, Dr. Pegg. So we'll now open up the floor to questions. As discussed with media earlier, we'll limit our questions to one question, one follow-up, and we'll ask all reporters to please ask your questions at the mics located behind the cameras there. So we'll start this afternoon with Luke from CKLE.
Hi. So I think my first question is for Dr. Kandola. Just looking for clarification on this Q&A here. Minister Green also said this too. So there's no gatherings of any kind in Fort Liard, but then it also says at the bottom that outdoor gatherings at private homes can't exceed 10 people and must be physically distanced at all times. So I'm just looking for clarification on which it is.
The clarification is for the next 14 days, no outdoor gatherings and no indoor gatherings, both private and public, and we'll correct that. Thank you for picking that up.
Yeah, my follow-up question is just on this cluster in Fort Liard, so there's no risk of, or no concern of public exposure. So are you guys able to confirm if this was some sort of household gathering that started this, or is there anything there that can be confirmed?
We can't speak to the individual cases. What we do know is that the initial exposure would have been out of territory, and the subsequent exposure would have been linked to the index case. Where that occurred, it's not open for comment, but we are isolating all 3 cases and then following up on close contacts for all 3 cases at this point.
Thanks a lot. Are you able to say whether the case, the isolation protocols were followed? You mentioned that they were in Hay River. Were they isolating in Hay River?
So, as I stated in my speaking notes, the way the initial case came forward was related to the public health advisory around the wastewater signal, and that would indicate there was isolation in Hay River, and that had triggered Protect NBT to call everyone who was isolated in Hay River, whether they were there or not, and to go forward and get testing. And because of that wastewater signal, which is the early detection signal, and because of the public health advisory, we were able to get timely access to a positive case, and then subsequently testing close contacts picked up the additional 2 cases. So in this scenario, this worked really well. We're still waiting for additional wastewater signals from Hay River just to make sure that there's still, if there's ongoing signaling happen or if it goes back to negative. But this is all a connection to each other, and it worked really well as an early warning system.
What I might ask City is, Dr. Pegg, can you speak a little bit? Reporters probably want to understand better the response team stuff. That might help, I think, some of the questions. If you can speak to that very briefly.
Sure. So the deployment of the rapid response team is in order to supplement health resources in an area to allow the existing healthcare infrastructure to continue to provide essential services, but also to be a link between the in-community resources and the supplemental resources that may be needed in order to accomplish all of the testing and contact tracing that comes out of a newly detected case. What's going on in Fort Liard right now are these nurses and logisticians who've been deployed to provide support in just that manner. So those nurses are providing testing. There are additional point-of-care testing devices that are available in order to increase testing capacity in Liard. As I said, all tests are confirmed by being sent to a hospital lab, but the sensitivity of the point-of-care test is such that a positive test has a very high risk of being then confirmed positive, and it also allows us to isolate that person and begin their contact tracing in a more timely manner than we would do if we were waiting for a confirmed test from the hospital lab. The response team has started with the highest risk contacts, so through the contact tracing investigation, those who are identified as having the most contact and the closest contact with the positive cases have been prioritarily tested. And then we work out in concentric circles from there in order to provide testing services to those who are still at risk but maybe at less risk, and then opening testing certainly to anyone in the public who feels that they may have been in contact or may have had a risk exposure or who may have had symptoms. So hopefully that clarifies a little bit the team there.
Yeah, so would you say that the situation in Fort Liard is under control now? I know you're expecting more cases, but you've got this containment order in place, you've done the contact tracing. Is it under control?
I would say that there are measures made in order to control this situation with the public health order, the containment that's in place. There's been a great uptake from the community of Fort Liard. People are interested in being tested. People are being supportive and kind to one another. There's been a great response. Welcome to our rapid response team. The nurses have had good cooperation from the community, and all of those signs would indicate that there's incredible motivation on behalf of the community. And again, speaking to what Dr. Kandola said earlier, this all came about as a result of someone responding to the public health advisory that came out of the wastewater testing in Hay River, which also indicates a real willingness on behalf of the population of the Northwest Territories to get this outbreak under control. People are responding and people are following the orders. We're doing a great job and we just need to continue.
Thank you very much.
Since there's no rules for the community of Fort Liard, will there also be increased enforcement to make sure that the rules are being followed for the next 14 days?
Thank you. Yes, like I said, it's all a government approach. We've been preparing in case there was an outbreak in a smaller community since the beginning of this. So we do have one task force officer that is currently located in Fort Liard. Another task force officer will be flying in today. And then in the middle of the week, we will have a third task force officer there. So we will make sure that we have enforcement officers in the communities to support the orders until this is addressed. Thank you.
Yeah, well, perhaps MLA Thompson would like to tell us what you're getting from the community in Liard. I assume your constituents have been reaching out to you. What are their concerns right now?
Thank you for the question. As soon as it happened, I was reached out by the band and the Hamlet. We've had, first of all, I guess I have to thank the Hamlet and the band for the work they're doing. They're put their EMO team in together. They're trying to work with the staff, whether it's the COVID or health, and so they've been doing a really good job. So they've been there trying to get the information, trying to set up a positive environment. I also have to thank the CPHO and the health departments for doing the work that they're doing. It's about trying to help the people be safe at the end of the day. And yeah, I'm getting lots of questions, and I do have to thank the Premier and the Health Minister. They've been able to communicate to me the information that I've been able to share. I guess the most important aspect that we need to really stress is 811. To get that information, you have concerns or issues, to reach out there. As both doctors have said, we need to do that. We need to work to help get that information out there. So again, the community has done a great job. They're working hard on this. They're working with the medical and the COVID staff, and they've been open arms, and they're trying to be kind and respectful to each other. It's unfortunate it happened, but we're working it together to resolve this, as well as the communities around there are asking questions as well, and we're getting that information out there. So I'd like to thank both the Health Department and the COVID Secretariat for the work they're doing for the residents of the Nahendeh and the Northwest Territories. Thank you.
We'll turn it now to Sarah from Cabin Radio. Thank you all for chatting with us today. There are rumors circling the Decho region right now that there may be People may have traveled to Fort Simpson, things like that. There's a lot of stuff on social media that I've seen, and people are really worried. Is there anything that you can say, whether or not any of that is true, whether or not you've heard anything like that? And sorry, by people I mean someone who has COVID-19 from Fort Liard.
So I'm just going to provide a quick update where what we know. We know we have 3 confirmed cases of COVID in Fort Liard. We know we have a good grasp on close contacts of those cases, and we know we have reached out to those close contacts, wherever they may be, to isolate. There is no scenario where there is an unidentified case in another community, and there's no scenario where there is an unidentified close contact in another community that hasn't been made aware. And I have full confidence in the rapid response team to continue the investigation and continue to reach out. Thank you.
Yeah, I think this one is for Dr. Pegg, but so the vaccine you say is hopefully going forward this week in Fort Liard. What would have to happen, like if for it not to happen, or what is happening for people who are in self-isolation that want to get the vaccine?
So the vaccination, what would stop the vaccination campaign from going on would be an unforeseen weather event or some other event such as that would prevent the team, excuse me, from arriving in the community. So that vaccination clinic is planned to go on as scheduled. We do recognize that people will potentially be isolating and may have difficulty accessing the vaccine as a result of that, and so there is discussion underway with the vaccine team to look at how we can potentially adapt the schedule and return potentially to Fort Liard potentially sooner than originally scheduled, because we are going to be returning to the communities anyway to provide the second dose, that perhaps that schedule may be adapted in some way in order to reach people who are isolating if that turns out to be a significant number. The other option would be maybe looking at other means that those people could get the vaccination once their isolation period is finished.
Yeah, thank you. I think this question is for Dr. Kandola. I just wanted to confirm, so the initial case in Fort Liard traveled through Hay River on the way back to Fort Liard from the outside the territory travel?
That is correct.
I'm not sure who, this might be for Dr. Kandola. I was wondering what supports there are for the grocery stores in the community, because I think it said curbside delivery has been set up, and I assume that provides additional costs and logistical challenges to the grocery stores. So I was wondering if there's any GNWT support for that.
Thank you. Yeah, I do want to put a shout out to the grocery stores for staying open and providing the curbside grocery pickups for this weekend. I do know that tomorrow that the Hamlet will be working with the grocery store to find a more long-term plan with this. The band has also stepped forward, is my understanding from the MLA. But any person in Fort Liard that cannot afford groceries, we are here to help you. Please contact the Income Support Services. And if you're in financial hardship that you cannot afford, we want to make sure that people have the supports necessary so that they can isolate the full 14 days. That is our commitment. Thank you.
Blair, Northern News Services.
This microphone? Okay. Yes, I think this question might be for Minister Green or Dr. Pegg. So with people who want to book a vaccine clinic appointment in Yellowknife, how long has it, book it online, how long has it taken for people to fully book the appointment?
So the vaccine clinic booking is organized differently depending on which community people can be found in. Some places it's organized through the health center, and in other larger centers, such as Yellowknife, it's being organized through a variety of ways, one of which will be online booking. The rollout for Yellowknife priority populations has started for some populations such as long-term care, those staff, and some front-facing frontline healthcare workers. For priority populations such as those at higher medical risk, travelers, older people, when that vaccine rolls out this week, there will be the option to contact public health, which is not an option right now, as the public health department is occupied with a number of things. And there will also be public messaging regarding how to access vaccine appointments that will be widely shared through social media, through the NTHSSA website, and through print media as well. So stay tuned. The NTHSSA website vaccine schedule is the best source of information, as that site is updated daily for vaccine clinic times and how to access the vaccine.
And follow-up?
How do you recommend people book those appointments? Should they do them over the phone line, or should they do them through the NTHSSA website? I'm talking about the clinic in Yellowknife and the community.
So again, how to go about booking those appointments is going to be communicated to the public as those times become more concretely organized. The preferred method will likely be through online booking, as we organized for the flu vaccination clinics, which rolled out very well earlier, last year at the end of 2020. So again, the best way would be to check back frequently through the NTHSSA COVID vaccine schedule website, and there will be instructions there as to how to go about organizing vaccination appointments.
Thank you. And our final question today, Ollie, Cabinet Radio.
Thanks. Yeah, this is probably for the Premier or the Chief Public Health Officer. It's a question from a Folliard resident who asked if we could ask about how advisories and all the proper practices to be followed in Folliard right now are being conveyed to a population that has limited internet access, has a language barrier, and no CDC radio right now, because I believe the transmitter's down in the community. Print documents will be ineffective for many in the community. They say, what is being done to make sure information right now is getting to the most vulnerable in the community?
So we'll let Premier Cochrane address that first.
Thank you. You are part of the communication, so I'm hoping that some of the people in Fort Liard will watch, either listen or watch your broadcast. We're working with the local radio station to make sure, and we're also developing posters for the community so that they're available in the grocery stores, wherever we can place them for the community members. And regular contacts. I've been in contact with the chief, I think 3 times yesterday. The poor mayor, Mayor Deneron, is working day and night. I believe I contacted her 4 times yesterday. So it's regular contact with the leaders in their communities, asking those leaders what they need, making sure that we have plain language information that's translatable, like said in English and South Levy, accessible to people. So whatever means we can, radio, posters, word of mouth from their leaders, whatever will help spread the word. Thank you.
And Elena, Thompson, I don't know, do you want to speak at all to if you're hearing anything from leadership in terms of how information is being communicated?
Yeah, thank you. So we are communicating through my office as well to both the leaderships, to the staff. We're asking them to get our information and questions that they've given to us out there to get that information to the communities. We do share it through our Facebook page, and leadership does it through theirs, as well as we try to get things posted in the community as best as possible. And we do have the opening of our lines and telling people to reach out to us wherever possible. So not only is the health department and the COVID-19 secretariat providing that opportunity to get that information out, we're sharing the information as well. Thank you.
All right, thank you to everybody. We're going to close it there. I'd like to thank again Premier Cochrane, Minister Green, MLA Thompson, Dr. Kandola, and Dr. Pegg for joining us, and of course for all of you for spending your Sunday afternoon to help us spread this message. As a reminder, your GWT COVID site is your best source of accurate information, so for residents watching, ensure you're checking there for information that helps us to sort of mitigate the rumor mill as well. And if you've got any follow-up questions, media, please contact press secretary at gov.mt.ca, and we'll end it there. Have a good afternoon.
Thank you again, everyone.